Hi everyone, I'm Dr. Maryam Zamani. I hope you know that if you watch my Instagram, and I am very excited to have a lovely friend, colleague, and journalist on tonight. Her name is Alex. I'm sure you all know her, Alex Steinherr. I just saw that she has joined. I'm going to see if I can accept. Oh, I think we're here. I just turned my light back on. Let's see if that worked. Yay! Hi, how are you?
I'm good. How are you?
I'm super well. How are you doing in quarantine?
You know, it's one of those things, like, I think where there's ups and downs. There's good days, there's bad days. But I think where we're so fortunate, is that we're able to work. Yeah. I think that's something that I feel like so grateful for, that I think when people are like, oh, he's just working from home, but there are some people who can't work from home, and
so many people can't work from home.
Yeah. So on those days where I'm like, oh, I just want to do this, I'm like, yeah, but remember,
I can't.
It's okay. You know what I mean? Like,
you always look so glamorous, Alex. I mean, like, even in quarantine work, look at you. You look stunning.
Okay. No. Number one, I was like, I'm going to be on a live with you. I promise you, I did it for you. I was wearing...
I did this for you. I put on earrings.
I'm not even, like, I didn't even do my nails. But, like, what I'm going to tell you is that all day, I was, like, my hair was up. I was wearing no makeup, whatever. And I was like, no, I'm going to go live with you. I was like, I need to make an effort.
An effort for you, too. I love you.
There you go. But, equally, like, that also gives me a sense of, I think, like, there's nothing wrong with letting it all go. But for me personally, that doesn't work. Like, I need sometimes to do this just to feel okay,
I agree with you. I think sometimes it's really nice. What I think is it's good to have a routine and to pretend like life is as normal. Of course, for me, it is a little bit slower because I don't have the clinic right now. But it's gotten me to focus a lot more on MZ Skin, which has always been my little baby, obviously. And I find myself, I'm volunteering a bit too. And so I find that my time goes by so quickly. And I think it's really important, I don't really look at myself in the mirror, except tonight I also have to do like a little tutorial, which I need to come and get some tips on you. I mean, I swear to God, I want to curse myself out by the end of it. I'm like, oh my God, I sound like a robot, and you're so natural, and you just go on with it. And I think it's really
But I think amazing. That's the thing, though. I just kind of say what I literally, because we know each other in real life. I'm someone who I'm on my videos as I am in real life.
Yeah,
I just talk like I talk. But the thing is, when I cannot listen to myself, though, because I notice that I go like, and I'm just like, I say it all the time, and it drives me nuts. But I think, there you go.
Yeah. But my husband says that to me all the time. He's like, but he always says, what is it? Are you, you're so American. Why do you keep saying like? And I was like, I don't know. I don't do it on purpose. It's just part of my lingo, basically.
Yeah,
Can't help it.
It's the same thing, but also like, there you go. See, I'm going to forget about it now. But the key really is to just, because you have such knowledge. Actually, I want to pick your brains because you have such a font of knowledge that it really is just about sharing, I think
information. That's what I love about
that's what it's about. Yeah, but you are like a doctor, so I think especially right now when we're in a situation where we're all locked in and, some of us do have most of us have a bit more time here and there for ourselves and maybe focus on our self-care a little bit. It's good to get information from real professionals and not just someone going, hey, this is a nice mask. And, just to understand things.
What are your favorite things that you've done in lockdown? Like, what are your favorite things anyway?
Beauty-wise or in general?
Yeah, both beauty-wise. I mean, because you're so great at sharing all your knowledge, and I think, and you do it so relatable. So I think that's what's really nice. I feel sometimes I say things that are a bit too, maybe I need to say it in better words that are more understandable. But
I have a few questions for you, actually, that I want to learn some stuff from. But if I'll tell you what I do. So the one thing is that even though I talk a lot about beauty and stuff like that, I don't actually, myself, I'm quite quick with everything. So I definitely take my time to do facial massage more. Now, I'm not a professional at it, but because, look, my home routine, if I'm being completely honest, my home routine is really simple because I'm lucky because I go and see professionals. So I go and get facials.
That helps too, of course.
I have LED, that, you know, I go and see people. So I don't normally have to do all that because I have a tendency, I have a lot of water retention, you know, I get very puffy. So I get all that taken out. But this is where I want taken out with a massage. So this is where I want your help.
Which kind of massage do you like?
So basically a mix of lymphatic and muscle, because I need both. But what I want to ask you, and this is exactly like, so for example, your clinic's closed, so we can't go and see you. I'm getting a lot of questions that I answer in terms of my instinct, because I'm always someone who's more erring on the side of caution.
But as you always should. It's always better to err on the side of caution. Absolutely.
But a lot of people are like, can I microneedle at home? And I'm like, please don't. But what do you mean? There's a lot of these at-home microneedling kits. I'm concerned because I would be worried.
I am too. So I don't generally recommend them for anybody unless they have like some sort of real knowledge and background. I think basically microneedling is when you use an instrument that has little needles inside of it and basically creates micro punctures of injury on the face. And the idea behind it is that it creates a cascade of events that helps to stimulate collagen production. It can help, like, you know, with fine lines, scarring, wrinkles, even pigmentation, because anything then you place on top of the face has better penetration because you've created this little channel. Now, done in the hands of a professional, I think it's really very important because sometimes if you're not accurate or appropriate in how you're, you know, doing the needling, you can actually cause injury, like proper injury.
Right?
Instead of causing, you know, a cascade of events to plump out your skin, you're going to have inflammation. You're going to have redness. You could even cause scarring on yourself. So I think it's very, I mean, there are some, and also there's a second part for me, which I'm like uber clean all the time, is that I'm always worried about how people cleanse and clean their
Exactly.
rollers.
You cannot, we're all disinfecting our homes, but you're not at the level of a doctor with your needles. So this is something that when people say, oh, those are and a lot of people are recommending them online right now, and I'm like, no, this is something, I'm sorry.
I agree with you.
And also it's very sunny outside, right?
Well, yeah, that's
sunny.
the other thing too, is that, you know, right now we have had like 50 days of sunshine, which is unheard of in London, but you can cause damage and pigmentation if you cause an injury to your skin. Now, remember, when you go to a doctor's office or any clinician who does this for you, you have a facial with some microneedling, they use a disposable needle. Like, they use that on you, and there is sometimes pinpricks of blood. You know, if you've done something at an office, you can range it. You can go from very superficial to much deeper, almost to the level of, you know, having a deeper, like almost like not a laser, but, you know, you can have deeper penetration, which has more bleeding and inflammation associated with it. But all of those needles are thrown away. They're not to be washed and like dried out, and you don't know where you're drying your instrument out. And you could, you know, there's bacteria everywhere. Even on our skin, we're filled with bacteria sitting everywhere. So I also worry about how clean people are getting these needles and how aggressive they are. You know, I don't even like cleansers that have any of the beads or that harsh abrasiveness to them. And even like a Clarisonic, in the right hands, it works really nicely. But in so many people's hands, they're so abrasive, kind of like overbrushing your teeth.
But equally, with the Clarisonic as well, or with whatever of those brushes, you put them in your bathroom. It's a damp environment. How are you cleaning them? You know, so I'm always really careful. So these are the kind of things, like, I get it. You know, we're all at home. And for people who are fortunate enough to be able to see you, and so I'm sure they're missing their treatments.
Yeah, well, but I have people saying, "Can I come through your mailbox and have like a?"
Yeah, and you're like, "Wow." So what are you telling your patients? Like, what are the things? So we're not going to microneedle at home, but what can they do? So people who don't get their filler, don't get their Botox, don't get their lasers, what can they do to kind of hold on until they can see you again?
So I think the most important thing is now, as you said, a lot of people do have time for proper skincare, and also to give their skin a little bit of a break too. So, you know, oftentimes people are more, you know, aggressive with like foundations and powders because they're going out. And even with Zoom, you know, you can do different things. You can have good lighting like I have here, you know, do different things to.
I just have daylight, and I'm wearing this, by the way.
Oh, I'm so
nice.
Oh
this
my
is
God,
so good.
I'm so
Yeah.
happy you like it. Oh, amazing. I'm wearing it too.
It's really glowy.
It's really, that's coming out. We just had delivery actually today.
And it's got an SPF 30.
It does. It's not enough if you're sitting outside in the sun right now.
No, but enough for this.
Yeah, it's enough for right now and any light that you have. But what I say for most people is that this is the time that a good skincare regimen is important. And I always say keep it simple, because if it's simple, you'll keep it in your routine, and consistency is the key for everything. It's just like exercise. If you want muscle tone, you can't exercise twice and say, oh, I'm done, you know, that's it. And then now that you have a little bit, you know, do the basic steps. Cleanse your face, you know, give yourself, you know, some things that can help enhance, like vitamins, minerals, amino acids, hyaluronic acid, peptides, ceramides, vitamin C. I mean, there's so many of them, retinol. And then also protect your skin just with SPF, especially now, you know, even if it's shady, because all the UVA rays come through the clouds anyway. But then if you have some time, some nice things to do at home are at-home treatments. So we all know about the masks. You know, those are really great for instant, gratifying, immediate effects of hydration.
I just have some of my favorites. I think your masks are so awesome. Like this is the original like mega mask. I'm gonna do that later.
I love masking, and I think now that you have 10-15 minutes, that's the perfect time to do it. And then afterwards, I think actually like an LED, if you have an at-home LED mask, that's a perfect time to do a mask.
I'm dying to have yours.
You know, we've been out of stock, and they're coming in, and you will get one. But you know, they sell so quickly, and I think that's something that, you know, I know you love LED, so you know the light salon is amazing, and you're always popping in there for a little refresh. But that's something that now the technology, it's not obviously as strong as what you're getting, you know, at the light salon or in a doctor's office or anything like that, but you can have a lot of good improvements with doing at-home LEDs. And the things to look out for is if you're doing an LED and it gets your skin really hot, then it's not a good LED. LED is light emitting diodes. There is no UV radiation, so people sometimes get scared. Is it going to make my melasma worse? Is it going to
does it help on pigmentation?
So if you have green light can help with pigmentation. And in general, rejuvenation always happens with red, yellow, infrared. So like you're getting it no matter what, but for, you know, pigmentation, green. The most important thing is if you're using an LED and it's making, you get warm. I mean, it feels like you have like
because the one, I feel like I do get warm.
You get warm, but you shouldn't feel hot. Like you shouldn't touch it. Like a kid shouldn't touch it and say, oh my gosh, that, you know, what is that, mommy? And also remember, it's very close to the face. So, you know, I oftentimes put an eye mask, you know, the eye patch, the gold eye patches on, and then I sit underneath for 10-15 minutes. I generally use, you know, I alternate if I'm using it. I use the green light and I use the red because I do have pigmentation, and I'm very
suddenly I noticed some pigmentation, and so I'm like, I need to, like baby pigmentation.
Yeah, I know, because you have flawless skin. I mean, like your skin looks like this in real life. So
well, no, but this is your tint. But the reality is that I suddenly started noticing, and this is what I think I was going to ask you, is so sneaky about pigmentation. Even though I have been so good at looking, you know, I'm not a sun person.
No,
I don't like the sun. I've been so good at looking after my skin for, you know, in my adult life, but I think it's suddenly, is it possible that the sun damage I had as a kid, without realizing that it's suddenly coming out to get me?
It can, but you're pointing to this part. You know why?
Because you're sweating.
Because usually when you put sunscreen on, you know, you put your cream on, and the places you forget are all along the hairline and around the ears.
Yeah.
And so that's where pigmentation comes. And I have to tell you, that's the hardest place to get rid of pigmentation too. Because,
I know.
You know, in your skin, you have beautiful light skin. If I wanted to treat that with some IPL, obviously I can go up to the hair, but I can't go anywhere where there is a little bit of hair, because IPL, for instance, has been used historically to remove hair. So you don't want to zap your hairline away.
I'll get like a hairline back to here.
So, you know, that's what's really important. And of course, you do sweat along the hairline. So that's where I think sometimes, like for myself, that's why I like sometimes having a spray SPF too. So, you know, older men who have bald spots or patches,
they spray.
I spray.
Are you kidding? I'm spraying my roots at the moment.
What are you spraying them with?
I'm spraying my roots. Josh Wood does a root spray thing.
Oh, that's amazing.
Oh my God, when you have dark hair
online?
like us, hello.
Well, you know, because you have flawless hair. I mean, I have grays, but thankfully, let's not look for them right now.
No, but there's this Josh Wood does this root touch-up stuff, which is really, really good.
I think I'm going to get that.
You need to get
come off on your pillow.
No, it's a really good one. It doesn't like it's kind of clings to your hair in a funny way. I mean, it does come off with shampoo and stuff.
Yeah,
but otherwise, I mean, I did dye my own hair too. But
did you?
Not greatly.
You can't tell at all. You just did that now?
I did it like 10 days ago. I need to do
it looks great.
Thanks.
Someone here is asking about cysteamine for pigmentation. So this is a new treatment that's come out, and it's a cream, based cream. And like, remember, anything that's treating pigmentation cream-wise, whether it's like over-the-counter cream or prescription cream, it takes at least 6 to 8 weeks to start seeing a difference. And all
like hydroquinone?
Yeah, hydroquinone, like a pigmentorm. It takes months of treatment and being really vigilant and staying out of the sun. So cysteamine, I've used it. It didn't work on my skin, but I will say that I've had lots of patients. I think it's like a 50-50, like a hydroquinone, and not like a hydroquinone because you have much higher success rates. It's just, it takes a long time. But cysteamine, it works really well, I'd say, in probably half of my patients. And then I think probably the other half either didn't use it for long enough or, didn't see enough of a result at that mark.
Because that's the problem, isn't it? Yeah, the problem is you're like, oh, I'm not seeing a result. Screw it. Sorry, but like,
you have to be consistent. I mean, I know we all want immediate results.
What's worked on you?
So for me, I mean, I have to say, it depends on the kind of pigmentation. For sunspots, I think IPL, if you're a lighter skin tone, works really well. You can do, you can either do a series of, I say 3 to 5. Most people after 3, they're super happy. And then maybe you have a touch up at, twice a year or something like that, if you need it. In mine is more hormonally regulated, and mine is melasma. And so I get little breakouts. And right now my skin is great because I have had 0 sunshine, and I have had all winter long for things to fade. The minute I go out into the sun, I'm Middle Eastern, my skin gets dark in 3 seconds with SPF, 50 every 5 minutes. So I look dirty, and I put it actually on my doctor Instagram so people can see, because, I always feel like clear skin, and which is why I love your skin so much, is that I think clear skin is always the most youthful skin. So, if you look at somebody in their 20s and they have some cute freckles everywhere, it's cute because they're young. When they hit their 30s...
You always say it as it is.
I do, because as you get older, they start to, coalesce, and they become sunspots, and then they become harder to get rid of. And so I always say, like, if you can start in your 20s with very good skincare and sun protection, then actually you're going to have much better outcome. Someone here has written Cosmolan. I use the stronger version of Cosmolan called Dermablend, which is only done by doctors. It's by a company called Meso Aesthetics. And I do that, and I document it always at the end of the summer, the end of August, when I'm just getting back to London. I put this brown mask on my face. It sits there for about 10, 11, 12 hours sometimes. And you have to be at home because you look like you have a brown mask on your face. And then you shed. And I know you don't love peels, but for melasma and after the summer, I think it's a really, really nice way to get rid of all that superficial pigmentation.
Do you know, I wasn't going to say, and it's interesting you say, because the reason I don't, look, I get it. It's always this thing. It depends where you are, and I understand it. If you're at a point where, I've never had an issue with my skin that was so bad that
you needed to have it. This is
so
true.
I fully understand it. If you have terrible breakouts, or if you have really bad pigmentation, that you're willing to do whatever it takes. I get that, and I totally respect that. It's just do the right thing. Don't do whatever it takes. Do the right thing.
Yeah, I agree with you too.
It's easy for me to say, like, oh, I'm not into that because I don't need that. However, I'm going to come and see you for some IPL. For sure.
Anytime.
Although
I don't see any flaws on you now, but yes.
No, but I do. I mean, listen, like I said, look, I don't have perfect skin. I mean, it's, for example, it's like the whole retinol conversation, like where people think I hate retinol. I do not hate retinol. I just don't think it's for everyone. That's all I'm saying. I think it's.
Have you ever used for long-term a retinol, or has it only? See, you know why?
The problem is that I can't get through the face. Like,
you can't get through the dryness phase.
When you don't have a massive issue to begin with.
That's what I was going to say.
You're not
hard to make your skin go backwards.
Exactly. And for me, in the nature of what I do, I don't want it to get worse to get back to what it is anyway. So I believe not every skin. You don't have to have retinol. you can use other things. You know, you can use peptides, you can do other things. And I just think, again, for some people, retinol is amazing and life-changing and like fantastic. But there are people who just react really badly to it. There are people who are too sensitive for it. There are people.
Absolutely. I mean, they're definitely, you know, I can tell you this. So most people who have retinol, if they use it very sparingly, even if they start off in low quantities. So like, you know, we have a retinol oil, a couple drops, and you use it twice a week and you slowly build up tolerance. You will still always get a little bit of dryness and flakiness until you've hit basically like the 2-month mark. And for people who have acne, people who have pigmentation, people who have like, you know, those very fine lines and things, it actually can make a huge difference on their skin. But because you have already such a good baseline and you've been taking care of your skin for so long properly, you don't have those concerns. And so I agree, you know, if you're getting good benefits from, there are a lot of great ingredients out there on the market. I personally love retinol, but I understand, I also agree that you have to listen to your skin. And if something, and I always tell my friends that.
So you probably personally also have a lot more genetically resistant skin than I have.
I do. Well, yes, just, you know, I do, because I'm
Mine is super thin. Like my skin, you know, it's like, people
No, you have great skin. You have good skin.
No, but everyone always says, oh, Alex, you have no issues. I do. My skin is very, very delicate, not sensitive. It's thin. So that's the kind of skin that when it ages, hello, you know, it's not. You
have a while to go. Don't worry.
Well, I've got you. But you know, it's very thick. It's not very thick. You know, it's not. That kind of skin.
You know, but a retinol or like a retinol alternative, and now there's some great retinol alternatives that are out there that are safe in pregnancy. That
talk to us about those.
So that might be. I never know how to say it properly.
Bakuchiol?
Yes. I can't say that word to save my life. I think I had a problem when I was younger, like with phonics or something like that.
No, but I think it's hard. I don't even know if I say it right, but I just say bakuchiol, and that's what it is. So do you think that that's good?
I think that's an excellent alternative for people who don't want to use a retinol, and I think that's something you should try. I will, by the way, I will save this live and put it up, and I'll send it to you too. But I wanted to say I love, someone wrote about Mesoaesthetics Melanin 130 plus pigment control SPF. Love this SPF because it has a light tint to it as well. And so when I'm in the summertime, I always use this product. It's not oily, it won't clog your skin, and it's a really great SPF. I don't know how else, I mean, we sell it at our clinic because
what's it called?
I do. It's called Mesoaesthetic Melanin 130 plus. Now listen guys, I always think that when you hear an SPF of like 70, 90, 100, anything that's 50 is going to give you, I mean, the percentage of change between like 50 and 130 is minuscule. So you don't need to, I feel like it's a bad marketing tool, but
oh my God, I agree with you. I went into a pharmacy today to get some stuff, and my mom wanted something, and you know, I can't see my mom, so I send her things, and then I saw something and it said SPF 90 on a product, and I was like, that is ridiculous.
You know, I think it's bad marketing because it makes you think that you're safe for longer, but you're not. You still have to reapply SPF.
I agree. Oh, acne-prone skin. Good question. Acne-prone skin.
So for acne-prone skin, for retinol, for acne-prone skin, nicotinamide is great for anything that's inflammatory in any way. So it's a vitamin B derivative, and it's a really great way to calm and soothe the skin. So I love nicotinamide. Like my gold mask has nicotinamide in it. I say nicotinamide. Some people
say niacinamide.
Yeah, I know. See, there I go again. My phonics. I'm probably saying.
I was like, I'm not going to correct her because maybe that's
no, you can correct me.
Maybe that's the clinical term, and I don't know what she's...
Americanism, I think, when I say it like that, niacinamide. Or maybe that's just my own way of saying it. But anyway, it's a really great anti-inflammatory. I think the one thing that people do with acne that's not great is that sometimes they're over drying their skin. So, and touching it. So anybody, you know, you can get scarring. Obviously acne is very disturbing. It's, you know, for me, pigmentation is like my skin is dirty and, you know, you just want to scrub it off. People who have acne are very self-conscious and there's a lot of emotional issue that comes with it too. And it's not in control. And people sometimes say, say, oh, you shouldn't eat this and that. Of course, diet may play a small role, but it's a very small role. And, you know, oftentimes it's hormonal. Oftentimes it's like your body just producing a lot of sebum. I will say that people who tend to have acne tend to have thicker skin. So you tend to age a little bit better in the long run, you know? So,
I was going to say,
so there's a pro and con with it.
And also, you know, and we know that retinol originally was a treatment as well for acne.
Absolutely,
so that's why I actually have a girlfriend who had acne when she was young, and they gave her retinol, and so now she's aged and her skin is amazing.
It's really nice.
She's been using retinol from a very young age, and now it's helped her anti-age as well. And acneic skin, this is what I see. This is where that's why when people say you hate retinol, I'm like, I do not hate retinol, but again, for that, it's perfect, and you're lucky. And also when people say to me, oh, my skin is so oily skins tend to be slightly thicker as well, don't they? I'm always like, you're going to age really well because I'm dry as the desert, so I have to like try them.
Me too. I'm all about hydration. So for me, like even my retinol is in an oil because I want to keep in the hydration. The minute I have dry, flaky skin, you can see every little fine line on my face, and it drives me nuts. So I mean,
am I wrong by saying that makes sense to me anyway? That because vitamin A is oil soluble, right? So it makes sense for me for it to be in an oil, right?
It is, but then there are some people who don't like, so basically some people like that drying effect. So if you're extremely oily, and remember it was originally created, you know, these topical prescription strength tretinoins were created for acne, and so they were meant to be somewhat drying. They're trying to reduce the amount of sebum production. They're increasing your cell turnover, which does make your skin dry and flaky. And so, but for an anti-aging, you know, perspective, and I don't really like that word, but for that sort of reason, I don't want people to have that dry, flaky sensation because I want them to enjoy using the product and seeing the difference. So,
you know, there was a question, which oil-based retinol do you recommend? Well, obviously MZ Skin. There was a question earlier about, actually the rosacea one's a good one, but someone asked earlier about, sorry, I'm taking over. This is your, I need to interview you.
There's so many great questions.
So basically there was, someone asked about the order, and it's a question I get a lot about which ingredients don't interact well with each other. Now, in terms of like retinol acids, vitamin C, and niacinamide, for example, what would you say people shouldn't put together in a routine?
So generally I say if you're using an acid, you should be using it in a cleanser. So I like acids, but only in a cleanser, so you're washing them off. So if in a mask or in a cleanser. So unless you're doing a specific treatment. So like I do have acids as part of like I have these Glow Boost ampules that are part of a routine, but they're a specific 5-day period, and I think that you can use your normal routine, but it's slightly different. But in general, skincare with acids, you know, I don't, unless you're using them on a body. Again, there's like all these little caveats. So,
there are always exceptions. I always say in skincare, there's guidelines, but there are always exceptions.
So generally, I like to use a cleanser or a mask that has alpha hydroxy acids or different acids in it because it helps get rid of any pollution, dead skin cells, and basically preps the skin so anything you place on top has better absorption. So if you don't cleanse your skin well enough, or you don't exfoliate, you know, a couple, you know, once or twice a week, then you're not going to get as much good absorption of the products that you're placing on top. And then I would say I love vitamin C, so I think vitamin C should be the first thing. You should always put the most medicated on first. So in the morning I would put on a vitamin C, and sometimes vitamin C for better absorption is with a vitamin E, so they work well together, and then you can put your moisturizer on and so on and so forth. I always layer the most medicated first and the thinnest texture. So if you're using a serum, that first, then a moisturizer, and then an oil. If you put an oil on first, then anything you put on top of your skin is really not going to go back into it. So, and then I tend to use, I have an encapsulated retinol that's in my, for instance, in the Hydrated Nourish moisturizer, day moisturizer with an SPF of 30, but that's micro encapsulated. It's 2%. It's a very low dose, and it's encapsulated, so it will go into the skin without interfering with, say, like the vitamin C C or any of the any cleanser that you've used on your face. So I think that's very important. Someone here said vitamin C gives me pimples. If it gives you pimples, I try different formulation. There's so many great formulations out there. I try one that's encapsulated. I would also try different variances, and maybe even introduce it into your system, you know, maybe 2 or 3 times a week before you go. And also, whenever you're trying out like an active, I would try one active at a time. I wouldn't start a retinol and a nicotinamide and a retinol, you know, and a vitamin C and an acid all at the same time, because you're bound to have irritation, and then you don't have no idea what it's coming from.
And also sometimes the thing of saying, I think that's a really good point, because when someone says, oh, vitamin C gives me pimples, well, it could be the vitamin C, or it could be whatever else you're using. So it's really about understanding. And I think that that idea of definitely, you know, like introducing one thing at a time, because otherwise you really don't know what's doing what and what you're reacting to. So that makes so much sense.
And also different formulations are different. Like you might have a vitamin C in a serum in one, you know, in one company, and it's a cream in another, and it's drops in another. So, you know, I think you should play around. If you feel that it's not good for you, then that brand might not be the right brand of vitamin C for you. And you know, you can try another.
And at the end of the day, it's also an acid. So, you know, some skins just react. And niacinamide actually is an alternative, is a viable alternative for a vitamin C, isn't it? In a way.
Well, it's a more of a vitamin B, but it helps in terms of what it's doing to the skin. Yes, as something like that's anti-inflammatory and soothing to the skin, it's an excellent. So another thing is like, you know, vitamin C in rosacea patients, or, you know.
So there was a rosacea question.
Yes, so those are things you have to use very sparingly first. So interestingly, you know, if you use a retinol or even a prescription strength vitamin A, you will get drying and flaking. And even those people who have, you know, people who have rosacea can also have acneic skin, because it's called, you know, that's part of the inflammation that happens with rosacea. And retinol and vitamin A can be used for it. But then those people tend to flare up a lot more. And I don't have too many anti-redness, you know, products in my range yet. We have the red mask, which is very soothing, and also the gold mask, which also has niacinamide in it. I'm going to change the way I say it.
Niacinamide. Actually, may I answer one question while it's here? Niacinamide gives me redness. What do I do? Okay, I just want to say to you, that's a common thing with niacinamide. It's actually called the niacinamide flush, right?
It is.
That's the thing that can happen. So it could either be, because it's happened to me, and I'm like, any redness and flushing, I panic. So it can either be that the concentration in your niacinamide's been too strong, so maybe it was like a 10% and you want to go down to like a 5%, but it goes away and it's harmless. It's just you want to go down. Am I saying the right thing, doctor?
Absolutely, absolutely. Thumbs up, double thumbs up.
but that happens with niacinamide. It can happen.
But it's a known thing, and it's not a complication, and it's not a reason to stop using it, unless, you know, you have burning and tingling or something else associated with it. Even sometimes you can, when you're flushed, have a little bit of tingling on it as well. So some people ask about affordable treatments post-inflammation. So, you know, my kind of go-to range outside of my own, obviously, is that I like, for people who have a lot of redness, I really like La Roche-Posay. I think they have a lot of really nice soothing treatments that can be used on the skin post having either, you know, breakout or very dry skin, or people who are on, you know, vitamin A by mouth, like, you know.
They just brought out a new product. I agree with you. They just brought out a new product. I just got it like 2 days ago, and it's in their, I think their Tolerian range, and it literally is like an instant soothing product.
Yes, it's quite interesting. I think they have a lot of very nice, affordable, like pharmacy and good grade ingredients. And so that's something that I would say, that if you're suffering from a lot of inflammation, sometimes it's nice just to go to something more basic and calming and soothing. And I think they have a really great range for redness in general.
And pharmacies are open, so.
And that's one of the few places we can all still go. Hopefully for things like this, as opposed to actually medication.
Other things, yeah. But rosacea, can I just ask you?
Yes.
It is a very complex issue, isn't it? There's not one answer, because I think I get a lot of questions. I think when you suffer with rosacea, it seems like there is no end to it. I mean,
you have to remember it's a condition. You know, like I always say, like melasma, I always say, look, like right now my skin's in a good place. in 4 months' time, in 4 months' time, it's not going to be where it is right now, and I'm going to have to start all over again. And it's like this sinking
feeling. If you stay indoors, you'll be fine.
You know, it's just even like right now I go out on my walks after the sun sets because I do not want to have any sun exposure.
I go in the morning, like
I know, but I'm a night owl. You're
yeah. Well, obviously I'm Germanic, right? You're Middle Eastern, so you're more like
But you know, I never lived in the Middle East, and I'm so
no, I know, but
it's so true.
But so yeah, no. So sorry. So you were saying. I'm interrupting you. You were saying
you know, but that's the problem is that acne, rosacea, melasma, these are all conditions. Like they're something that you have to learn. I don't want to say live with because that sounds like it's like a horrible thing. Yeah, you have to manage. That's a great word. You have to manage throughout the year, and you can have flare-ups, and you can have time when your skin is better and times when your skin is worse. And oftentimes now there's so much stress and uncertainty. People have lost their jobs, they're furloughed, they don't know when they're going to go back to work. They don't know if their health is, you know, there's a lot of underlying stress here. And so that's going to exacerbate any inflammatory condition. So cut yourself some slack and give yourself a break and say, you know what, I'm doing the best that I can do. You know,
but equally though, it's I think you're so right, and I think that we're sometimes not aware of how much this internal stress is affecting us, because regardless, yes, the worst case scenario, you lose your job, but even if you're not, like just the stress of having your homeschooling or just the stress of just this general uncertainty. But what I think is helpful for hearing from you is what it's about managing, but what are some of the tools? So what can one do when it flares up?
So I would say, you know, I can't remember the name of it, but there's one cover-up that I absolutely love for rosacea-prone skin, and I buy it on Amazon, and it will come to me. It is green in consistency, so green masks the red, and it's really, really lovely to be able to put on, and it helps with that flushing. And I also like Dermablend by Vichy, which is another very light foundation that helps give you an even skin tone. So at least you can sort of.
There's another one it's called Oxygenetics that I love.
Oh yeah, Oxygenetics is great.
Oxygenetics is great too, and there's even one there's a normal one, and then there's one for acne.
There is, so then you don't have the redness. Excuse me, the potential. All of these are like non-comedogenic, by the way, so they're all really great for acne-prone skin. Then you can get different things that are redness neutralizers. So you really want to calm the skin. Don't be aggressive with your skin. If you're having a flare-up, don't throw this kitchen sink at it. Less is more in this situation. Use a calming mask. I like a Ven hydrating mask is also something that I think is a really nice one. You can put a very thin layer and sleep with it. Don't even bother washing it off. Just sleep with it at night. I have, like, for that kind of, you know, inflammatory skin, I have the red mask, which is really great because it has a lot of different vitamins and minerals.
Which is this one.
Yeah, it's that one. I have the box set.
Can you wear this? Sorry, I'm jumping, but when you put your LED mask on,
you can't wear.
Do you put it on clean skin or do you put it on?
So LED, you can use. I always say wash the face, and if you'd like a serum, you can always put a hydrating serum. You can put B5. You can put a hyaluronic acid.
But no active.
No actives and no SPF. Although there's no UV exposure, but no,
it's a barrier. Yeah.
Or so either you cleanse your face and you put something like that on, or you cleanse your face and you do a mask like that, and you can rub in the serum a little bit, and then you can place the mask on. The only place that I would say you can put a mask is if you want to in the under eye area. But remember, the light will not go through that mask because it's opaque. It has to go onto the normal skin, and so you know you won't get that benefit for the eye area at the same time.
When do you use your mask? What time? Morning?
I'm a night. I don't do anything in the morning. I mean, I'm like a very 5 minutes. I'm out the door generally. Even in quarantine times, like I might not be out the door, but it's 5 minutes still. So I like to take a bath and do a. You know, I usually do it after I've exfoliated. So either with the Radiance and Renewal, or I just use the cleanser and I leave it on for a few minutes. And then I'd like to put one of these masks on now that I have a little bit of time. And then after that, I take that off, rub in the juices, and then I put the LED on. And I use either red or green light for myself.
And you do it in the evening before bed?
I do it in the evening, not before bed because it's very bright and it's a very big, good mood enhancer. But you know, sort of
after dinner,
hour or two. Yeah, like an hour or two after I've.
And do you use it every day?
No, I don't. I wish I did. You know, I even have a full like, I have a proper in-office LED light in my house, and I made the portable one.
I wish I was in quarantine with you.
I know. I couldn't even go downstairs into my my old nanny room to use it. So that's why I wanted one that like I could keep like by my bed basically, because I had one in my house and I was being lazy about it. So I think you can use it in the morning or the evening. I have to say in the wintertime, it's a really great thing to have too, because as I said, it's a mood enhancer, and so you feel amazing afterwards. And so I just think it just makes you feel good too. I mean, like, there's a really great feel good. Would
you say, and I agree with you, would you say that if you use it every day for what, like 15 minutes, 10, how much is it, 15?
10 to 15 minutes is a good amount of time.
If I use it for 10 to 15 minutes every day, do I get I'm someone, if I have time, I go and get a weekly professional one, right?
Yeah.
Which I don't always have time, but let's say, how is using it every day, is using your one every day the equivalent of one professional treatment a week?
I mean, we don't have any studies, so I can't tell you
but roughly
that's true. But this is about, like, you're getting 40% of what you would in an office. So, and in an office, you do it for about 15 minutes. You obviously have more LEDs depending on which light you're using. Yeah. And so so there's a higher intensity, but you will have benefits from it. Remember, this has been, we know that red light, for instance, really rejuvenates the skin. It helps collagen production. It's great for healing. It's great for rosacea. It's great for inflammation. It's great even after having surgery. If you had one that's more malleable, you could put it on a scar, for scarring. I think it's a really nice treatment. And
I'm a huge believer in it. I just want to have your seal of approval, basically. So
but
I agree. I think if you're going to invest in something, invest in an LED mask if you're going to actually use it.
Yes.
Because that's the other thing. Like, if
you don't want to keep it there, there'll be a newer model coming out. There's always, if you're going to use it, invest. If you're not, then it's like no point buying that Peloton bike if it's just sitting there and you're going to. And it's a hanger for your clothes. Yeah, exactly. I was I like going to the gym. I like walking. I'm never going to use the Peloton.
Exactly. Is 2% of an active ingredient too little? It depends on the active ingredient.
And how it's
formulated. Acid at 2%. Is active, but it depends on the ingredient, right?
And also how it's formulated. Remember, if something, it's how big the molecule is and how it's been, what vector it's in to get through the skin. Because even though we put all of this lovely stuff on our skin, we don't always get all of that going into our skin. So, it's really about how it's formulated. So yes, and also how, in terms of actives too, some actives, don't keep well. So once you've opened a bottle and you haven't used it for 6 months, then
you mean like a vitamin C that has to be used very quickly.
You got to toss it. Yeah. So I get a lot of products too, just because I'm always trying out other people's lines and everything. And yesterday I was like, someone on my team thankfully sent me a new vitamin C, my Brighten and Perfectant, which I go out of so quickly. But I was like looking around to see if I had anybody else's, and I opened all of them up and they were like dark brown, and I was like, nope. Chuck. And I thought I just did a cleanse with that like a month ago. So just shows you how quickly things can oxidize. What SPF do you like? There's so many questions about SPF, which
me personally, well, especially right now, I think you have to be super careful, because if you are going for your daily walk, unless you're like me and you, like me going at the crack of dawn and you going like at night in the dark, but still, even then, I personally, I use, what do I use? There's one that I always use, which is HelioCare, which I buy in a pharmacy. So I love that one because it has it. I like the tinted ones. That's why I like your Tint and Protect as well, because I feel like I get extra protection through the tint as well. I feel like the pigments plus the SPF. But I also wear a cap. I wear
big sunglasses. That's the one thing I wish I'd done earlier in life.
So I like HelioCare, but then if something more affordable, I really like Garnier did a new one, an SPF 50, which is really good. It's very light as well. It's a SPF 50, UV sensitive, something like that. But I think SPFs, like I get more questions about SPFs as well than most other things. It's really interesting because I think an SPF by nature, look, my honest answer is I don't think there's a perfect SPF. I don't think there is a perfect sunscreen. There's no perfect, because people are like, oh, mineral is better than chemical. And I'm like, no, like, honestly, there is no perfect one. But
I like combinations. I use both.
But you need, I agree with you. I like a combination. And I think, you know, but we have to use one until there's something out there that is non-toxic, you know. I think that's what.
Did I lose you? Oh, no. Great. I agree with you.
I think you lost me for a second. My dad was calling
the other brand that I like for like SPF, like a high factor SPF, is Elta Md. They have like 2 versions. They have a normal and they have a clear. They have a really nice one as well. They have one that's good for acne prone skin, so it doesn't. I love SPF, but if it gives me, because I never get acne, if I get a breakout with an SPF, I can't use. I just won't use it again, because I don't want to have acne, because I want to protect my skin. So
and that's
I think those are good.
People can break out with SPFs, and that's why I think there are so many issues always with finding the right one. And then for me, it's more the irritation in my eyes. I don't break out, but I have very sensitive eyes. So even if I don't rub it into my eye, but even if I sometimes my eyes just, like, hay fever at the moment is like the big,
out of control.
Horrendous for me. I mean, forget the lockdown. It's the hay fever. But the hay fever is making me feel unwell, you know, so I'm literally like constantly like that. Anyway, sorry.
I do take, you know, if I have very bad hay fever, the only thing that ever works for me is you have to get it from your doctor, but it's called Dymista, and it's amazing. It was a really great way. It's cleared up so much. I still have, like, you can see a little bit of puffiness here, but
what's
like otherwise, it's called Dymista. I'll DM you afterwards.
Can you DM me, because that's what I'm doing in the pharmacy constantly. I'm like sniffing, and they're like going, step away, and I'm like, no, it's hay fever, you know. I'm like, literally, I take like 3 pills a day, I'm telling you. And anyway, good question. We're almost, do chemical peels thin your skin? And that's a good question. Do chemical peels thin your skin?
Okay, but before
I'm
going to say one thing beforehand, just one more thing, because people always ask about makeup. Makeup is not enough for SPF. You always have to SPF on top of it. And if you're out and about, so in the summertime, I don't wear makeup on top of my SPF, which is why I like a tinted SPF, so it makes me feel like I have something on my face. But in London, if I'm going out and I want to top something up, that's when I use the mineral makeup, and I use makeup with SPF. And so I personally like the Shiseido one, so I use that as like a touch-up, but there's a lot of different ones out on the market, and so you can always top up. If you're somebody who wears makeup during the day in London and you want to top up, that might be a good alternative for you. So I do not believe that, let me phrase that again, because there's exceptions to everything. So generally speaking, acids, fruit enzymes, and, you know, light acids that you can get most of the part over the counter, because remember, the regulation is very different in different countries. So, you know, for instance, in the EU, there are actually much stronger rules on what the percentages of acids are. And so my formulations are weaker than perhaps, you know, like the Ordinary has some acids, and I point them out only because I always find it interesting how regulations are different in different countries. So the Ordinary, I can't remember, but they have like a 30% acid out there, and that is dangerous to use at home. So you can burn yourself, and if you burn yourself, it's different exfoliating with an acid than having a chemical burn, you know, essentially. And so you have to be very careful. You know, regulations are easy to come and go, but in actuality, I could never produce in Europe that product and it would not pass safety measures, because there are issues that happen in higher percentages. I'm not saying anything bad about the Ordinary, because they have a lot of great products. I'm just saying, you know, the regulations are very different, and so not all acid is created equal. So if you find that your skin is very sensitive to an acid that you're using, then absolutely you have to listen to your skin. You know, like, it's not something like, oh my God, I have to bear through it in order to see the pot of gold.
But do they have the potential of thinning the skin?
So generally speaking, acids, if used well, can help stimulate collagen production. If they're used inappropriately, or if you get a burn from having an acid, then you can get that thin, whitey type of, or scarred type of skin. So either it can go very thin or it can go very scarred. So like, I don't know, you know, like when you look at the older generation where they used to use very deep peels.
That's paper thin skin.
Yeah, they have paper thin skin because they've almost created that extreme of almost having like a proper like a really bad burn, you know, like so I have to say I like acids in light doses and as a light thing, as a light sort of treatment or medium peel, but it has to be done in the care of somebody who really knows how to do it. So the Dermablend peel is considered like a light to medium peel, and as a medical peel. And if you think about that, I'm sloughing off a lot of layers of my skin, and I never get raw. I don't, you actually just get very dry skin and your top layers come off. But if you're doing that at home and you're not doing it properly, and then you're putting vitamin C and a retinol and all these other actives on top, you can cause damage to your skin. So just make sure that you're using things appropriately. And again, sometimes less is more. You don't want to over stimulate, not stimulate. You don't want to over treat your skin and create injury, essentially.
Well, there's a question. Acids give me freckles even with SPF. Well, this is what will happen probably is that, if you will have used maybe a too strong of an acid and your SPF probably wasn't appropriate, because clearly acid, if you need to wear an SPF, because especially an AHA can make your skin photosensitive. A BHA is anti-inflammatory, so a BHA, a salicylic acid, is not photosensitive, but regardless, you should always wear an SPF anyway. But AHAs do make your skin more photosensitive, so you do have to.
Acids, retinol, all of these things, they can all make your skin a little bit more sensitive. So I think it is really important, to always just make sure that you have the SPF. I mean, I feel like I spent my youth in the sun, so I was of that stupid generation that would put olive oil on her skin, and so I'm paying for it. I have tons of fine lines and I have pigment.
You look amazing, so don't even
You're
start.
Very sweet, but it's just you have to protect your skin. Like my kids, you should see me. I'm running around, and for my kids, I love La Roche-Posay, so I'm running around, and I like the white one on them because then I can see exactly where I've hit. I'm like that mean mom. My daughter's like, Mom, why are you making me white? It's because then I can see where I actually.
Because you'll thank me later.
Yeah, you'll thank me later when you have beautiful glowing skin. Exactly.
I'm definitely, when I was very little, I swam a lot. I swam competitively. So we didn't get it. I grew up in the States. I was in the sun all the time. So swimming outdoors. So, I mean, it's only in my late teens that I started being diligent. So luckily it saved me for a lot, but still,
I agree.
I like this question. Do we get acne on the same place again and again because the skin tissue is damaged? Why do you get acne in the same areas?
So sometimes you can have, it can be hormonal, but oftentimes it's also cystic. So you may have had a small lesion there, and then it hasn't actually completely resolved, and so it keeps coming and going. So that's why there's different kinds of acne. There's, mild, moderate, and severe. And I'm not an acne expert. I don't claim to be. But basically, when you keep having inflammation in the same area, unless you've gotten rid of the inflammation there completely, it can come back again. So if you do have a spot that keeps recurring, it might actually be like a small cyst underneath the skin. And sometimes,
you know what? Sorry to interrupt you, because I rarely get spots. But when I do, it's always here.
It's always in the same space.
It's here.
So you may have a little spot that's there, that's.
I might have a cyst under, and sometimes it doesn't even come out. So I think there is something there.
There may be.
So can I get rid of that?
The next time it happens, you could have a very, very small amount of a steroid injected into the spot to help the inflammation go down. And sometimes that's enough to make it go away. It's not without its own set of complications, potential complications. So, I've never seen you with a blemish, but, if it comes,
come on! I'm not immune. I am not immune to getting spots. It doesn't happen a lot, but I'm not immune to spots. I'm not immune. And you know what? I'm not immune to aging myself. So, it's it's not like I drank something special or anything. I'm just super consistent, and I learn a lot from people like you, It's
always a learning process. We're all always learning.
Yeah. But I think the thing is and I hope you'll forgive me or agree with me on this. It's important to see professionals and doctors and things, but you have to be consistent at home. You have to do your home care routine. Again, the same thing you were saying about the gym, seeing you once a month, great. But if I don't do anything for the rest of the months at home, what's the point? You're going to be what are you doing? Like the home care is so important, and I am so consistent. I cannot tell you. I can count.
We know you are. You're on Instagram. I see your routines. You're awesome.
But I mean, I can tell you on one hand the amount of times I went to bed in my life with my makeup on. It wouldn't even occur to me. Like, it's one of those things, like, I don't do anything magical. It's just very, very consistent, and I know what works for me.
I do too. And if I feel, I do try different things. So, but I can tell what is going to work for my skin and what's not. And I always like, someone asked me if I had a powder in my room, and I was like, I don't own powder. I'm always looking for the glowy, dewy skin. I don't really. I was like, I don't need it.
I'm not into powder. My only downfall is that I love a tan, but not a real tan. So I'm a real fake tan crazy person.
Which one do you like?
Tan Luxe is my favorite. But can I ask?
Tan Luxe, sorry, face is very nice.
I love Tan Luxe, but can I ask you something?
Yeah.
And I know we don't have much more time, but this is actually a question I want answered. Do you think using fake tan can exacerbate pigmentation, or does it bring it out more, or does it just bring it out more?
So I love a fake tan, and I use a lot of Amanda Harrington's products. I love her products.
Oh, she's amazing. Yeah.
But I can't do fake tan. I love those Luxe drops, but I can't use them on my face because in the areas where I have melasma, they become darker. So we don't know why. I've actually done a lot of research on this to find out why. But I think the top layer of the skin on areas that have hyperpigmentation is somehow different. And it's not just the melanin. I think it's something else, because melanin is deeper in the skin. But I feel like anything that gives you a fake tan latches onto that pigmentation and makes that pigmentation worse.
I will literally, when I put tan on, it's amazing for the first few days. And then as it fades, I'm suddenly have like the sun. Like
it doesn't fade as the same. It doesn't fade.
But I'm like, but it's always the same areas. So that's why I thought it was the melanin, but I'm still searching. Nobody can give me an answer.
I am too. I mean, I do a PubMed search literally probably 3 times a year on this, because every time I always go back and I'm like, oh, I'm going to try it again, because now my skin looks fairly clear. But I promise you, if I put Tan Luxe on my skin tonight, the areas that are they're almost gone, they're very faded, but they would pop out even more. And
but do you think it's just the color, because obviously now I haven't tanned in a while, so I have got nothing of it. But do you think it's long-term damage? I mean, do you think
I don't. No,
do you think it actually makes the pigmentation worse?
I don't think no. It doesn't make your pigmentation worse. It's just a superficial, with a couple exfoliations, it'll be gone.
So question, can fake tan age you with the DHA?
So there are no studies that are saying that now that I know of, but theoretically, you never know what. Oftentimes, unfortunately, it takes a long time before we know what's actually really good for us and what isn't good for us.
Because I'm telling you something, if DHA ages you, I'm aging. That's all.
Then it's a very slow aging process. Maybe we'll find out it actually does the opposite. But actually, they may find that, because they say, darker skinned people are a little bit more protected against UV damage. And so theoretically, if you're fake tanning your skin, you might have a little bit of protection against that too.
I love you.
Don't take that as a truth, but that's,
someone just said I find I look older with a fake tan. I think that's that I actually think I look fresher, but that can be because it's a little bit drying. Fake tan is drying. Maybe that's why.
Drying. You can use a very good yes, and also I also think that sometimes, although Tan Luxe and Amanda Harrington's do not, is that sometimes if you're prone to having like comedones and like little blackheads and whiteheads, you can see them a little bit more in people who have more oilier skin types. So, and some of those people, I don't think that, doing the face is necessarily a good thing to do.
You just do your body and then do the face.
Yeah, yes, exactly.
And use tint and protect. I think we're almost done.
Yeah, we are. It's gonna, I think in like a second, it's going to give me my countdown. So thank you so much. This has been super fun. I love seeing you as always. And I've gotten, I like now this is like my 4th Instagram live or something. It's been interesting to have a different way of doing things, but I always love seeing your pretty face, and so thank you so much for joining.
Thanks for having me, and I'm definitely, can I come and see you when this is over to do my IPL?
I wish you could, yes, but actually maybe you wouldn't want to do IPL right now.
No, but when it's over, we're not over, it's not over yet.
No, but I was thinking more like in the fall, because we're going to have summer and hopefully we're going to be able to go outside. in the sunshine too.
Just for something else. Then as soon as I can see, I'll come and see you.
Love you. Thank you so much again. And thanks everybody for all your comments. And I will save it. Bye.